Hello, Jason Checketts here with Insurance Professionals of Arizona, where we help unwind the complexities of Medicare. We also help agents grow their books of business. Today I'm going to just walk through the latest and greatest how to find the most cost-effective drug plan. Okay, we're in annual enrollment. You probably have a handful of clients, if not more, who have standalone prescription drug plans. Now's the time. I always wait until the first week of November to start this process. I don't do it early on in annual enrollment because I feel like it takes a couple of weeks for Medicare.gov to just get everything worked out and smoothed over and all that stuff. And all the data now is pretty accurate. I also recommend you don't use Sunfire, you don't use Connexure, you don't use Medicare Center to do this drug analysis. I feel like that information, that data is not as accurate as what you're going to find here on Medicare.gov. So it's real simple. When you're ready to do a drug analysis to find out which drug plan is most cost effective, go to Medicare.gov. The screen looks like this. This screen will change probably in just a few weeks. It'll look different. This will go away. But you're going to just come on the screen and find this little section that says Find Health and Drug Plans, find and compare plans in your area. You click on this little button that says Find Plans Now. Now, you've already asked your client for a list of their medications. You've also asked your client which pharmacy or pharmacies they prefer to use. Those are the two pieces of information you need. And you're just going to start this analysis. In this case, we're going to say we're going to look for a plan for the year 2024. We're going to put in our client's zip code and we're going to hit continue. Now, you can use this same process to look for which Medicare Advantage plans have the most cost-effective drug costs, right, based on your client's list of drugs. But today we're going to do it for just standalone drug plans. And by the way, what's great about this tool is you can go back and forth. You can toggle back and forth between Advantage plans and standalone drug plans. Once your data is in here, I'll show you how to do that if I remember. But you go to drug plans and then hit Find Plans. If your client gets any sort of extra help through Medicaid or the Extra Help program, you can select that here. Otherwise, in this case, I'm going to say, no, I don't get any help from these programs. And I'm going to hit the next button. Next question. Yes, I do want to see a comparison of the plans here based on my medication list. So you're going to say yes to that question and then hit next. And at this point, you're just going to start putting in your client's medications. Okay, so I'm going to just put in here that they take Jardiance. That's a very expensive medication. They take a 25 milligram tablet and they take one a day. So they're going to take 30 every month. Makes sense? If they take two a day, you would change this to 60 every month. But in my case, my client takes 30, so I'm going to say add to my drug list. Okay, so I've got Jardiance listed in here. I'm going to add their next drug. They happen to take a drug called levothyroxine. So here it is, levothyroxine sodium. That's the drug name. We're going to add that drug, and we're going to ask them, of course, again, what MCGs they take. In this case, it's micrograms. And you're going to also ask them, do you take the capsule or the tablet form? And this is critically important. You need to make sure you get it right because guess what? A capsule is very expensive with levothyroxine, whereas the tablets are the tier 1 generics, right? So make sure you ask. If you ever see tablets versus capsules in your drop-down, make sure you clarify with your client which one they're taking. In this case, he takes a 75 microgram tablet for one a day, so 30 every month. We're going to add that. And let's just say they also take allopurinol or whatever. I don't say these right, but that's the drug right there. And let's just say he takes a 300 milligram tablet and one a day. Okay, we add that in here. We're going to add another drug. He takes pantoprazole. Can't type. There it is, pantoprazole. And he takes a 40 milligram delayed release, and he takes that one a day. So we're going to add that drug, and then he takes atorvastatin. All right, so let's put atorvastatin in there. So there's your atorvastatin, and it just happens to be a 40 milligram tablet, one a day. Let's add that, and then I'm going to do one more thing for you just so you can see. Let's say your client says, oh, and I take Symbicort. Symbicort, there it is right there. If you click add drug, it's going to ask you, hey, this drug has a generic. Again, make sure you ask your client, do you take the generic called budesonide formoterol or whatever. You're laughing at me. Okay, and make sure you clarify this. And if they say, yeah, I do, I take the generic, then click add generic. See, and then it'll come in and it'll change it from Symbicort to the generic. Okay, so this client doesn't actually take Symbicort, so I'm going to take that drug out. And we're going to go back to my drug list, and here you go. So here's their drug list, all complete. And now I'm going to click right here. It says done adding drugs. Now, at this point, you've already asked your client, or you're going to ask them which pharmacy you prefer to use. This is important because some clients will say, I only go to Walgreens. I'll go nowhere else. This Walgreens by my house is my favorite. My friend works there. I'll only go there. Okay, if that's the case, then just select Walgreens. Okay, so that you don't have to worry about comparing prices with other pharmacies. But a lot of times your client will say, I don't care which pharmacy I go to. I want to go to the pharmacy with the best prices. Okay, well then in that case, we're going to compare Walmart with Walgreens. We're going to choose CVS. That's another good one to put on here. And then we're going to put Fry's. Those are probably for here in Arizona, those are probably the core drug pharmacy, the pharmacies that you would want to compare. I'm going to move my face here, and we're going to hit this little done button right over here. Move my face back, and here we go. This Medicare.gov system will sort the plans out based on the lowest cost to your member over the year, right? So in this case, it's saying that this plan right here, the WellCare Value Script plan, is the most cost effective. It happens to be a $0 monthly premium plan here in Arizona. And then this is the annualized total drug cost plus the premium cost for all of 2024. In this case, because we're doing this for annual enrollment, it's for all of 2024. So you can say to your client, hey, just because you're taking some expensive meds here, you're going to spend about $792 annually in copays. Okay, and most of the times they go, I know, I take Jardiance, it's expensive. Okay, the next most cost-effective plan is called the WellCare Classic plan. It has a monthly premium of $37.30. So $37.30 times 12 plus copays equals $1,340. So it would not make sense for you to put them on any other plan at this point because they're just going to get more expensive. $1,355 annually, $1,742 annually. It just keeps going up and up and up, right? So in this case, you're going to literally tell your client, hey, the best plan for you based on these list of drugs you gave me is the WellCare Value Script plan. Now, remember how we said there's 4 pharmacies that we wanted to compare prices to? Well, let's go look up that. I like to go right here where it says view drugs and their costs. And I invite you to read through this, get to know everything that's in this page. It's super confusing at first, but once you start digging in and really kind of reading it, it's going to make sense to you. A couple things to point out. You'll notice here, CVS annually would cost $990.22. Fry's would cost $997.21, so $7 more on this plan to go to Fry's over CVS. But look at Walgreens, $7.92. So Walgreens is the winner for this particular plan, right? For this particular client. So you're going to say to your client, listen, you're going to have to go to Walgreens on this plan to save the most money. Don't go to Walmart. That's $1,308. CVS and Fry's will be $990 and $997, but if you go to Walgreens, you're going to spend $792 annually in copays. Okay, it's just the way it works out with this particular plan. Now, if you want to also show your client when you're going to hit the donut hole, this next section tells you when that happens. And at Walgreens, they'll hit the donut hole in October, right? So which means they're going to start paying more for their drugs. And it says here that they will not get out of the donut hole. And you can even give them what they're going to pay each month when they go pick up their medications, right? So this tells me that Jardiance is a tier 6 drug on this particular plan. So it's actually going to save them money being a tier 6. However, they will still hit the donut hole. And they have a large deductible. But again, there's no way around it, folks. Sorry, you take Jardiance. You're going to have to go to your doctor and see if there's a cheaper medication if you don't want to pay these high prices, right? Or go to your doctor and say, hey, can I get some free samples of Jardiance to help keep me out of this donut hole? If they can get 2 or 3 months worth of Jardiance for free from their doctor, then this will just prolong their donut hole, which means they won't hit it at all. They'll just be paying the $13 for the rest of the year, that's a pretty good deal, right? So there's there's advice you can give to your clients in cases like this when they're taking expensive medications. Okay, now let's say at the last minute your client says, you know what, maybe I want to switch to a Medicare Advantage plan. How much would my drugs cost me if I went to a Medicare Advantage plan? Well, come back to this screen right here, and right here where it says plan type, you can actually change this to Medicare Advantage plans. Okay, hit apply, and now it'll start telling you what your drug costs would be for Medicare Advantage plans. So this Gold Kidney plan would cost them $480 annually. This WellCare No Premium plan will cost them $668, and so forth. Scan will cost them $669, and so forth. So you can keep going through here. Cigna $780, and so forth, and you can start analyzing which Medicare Advantage plans would have the lowest in their drug costs based on the drugs that they take. Okay. Hope that helps. Please call me if you have any questions. Happy annual enrollment.